The Hill Laboratories AirFlex is designed with a perfect blend to both help improve your performance as a doctor while retaining maximum patient comfort and success. The versatility and many options that are available with the AirFlex provide doctors with a custom-built table to treat patients in their own way. The AirFlex is an air-powered, full-featured manual flexion and distraction table with the option of adding air-powered drops and automatic functionality for both flexion and distraction. All tables come with electric elevation from 21.5 inches to 29 inches or from 22 inches to 30 inches. Every AirFlex comes with a tilting headpiece that can lock anywhere from 30 degrees positive to 30 degrees negative. The table also comes standard with a thoracic release section that can lower or lock in any position. The foot end of the table has an adjustable slide-out ankle support to accommodate taller patients. Preparing a patient for a flexion treatment is easy. First, position your patient on the table and secure their ankles with the ankle straps. Pull the foot section out and tighten the slack. Insert the tiller bar into the foot section and turn the table on. Turn the selector switch to distraction and use the foot pedal to distract your patient. Palpating the lumbar region will help determine the amount of distraction the patient is receiving. With your patient in distraction, turn the selector switch to flexion. Because the AirFlex uses air to counterbalance the patient's weight, use the foot pedal to preload the table to about 30 to 50 psi. While holding the end of the table, disengage the flexion handle by turning it to the 3 o'clock position counterclockwise. Then counterbalance the table using the foot pedal to a horizontal position by increasing or decreasing the air pressure. Once the patient is perfectly counterbalanced, you can manually flex your patient with ease. To use lateral movement with flexion, disengage the lateral handle counterclockwise. This combination will allow you to perform smooth and effortless circumduction. The table also comes with rotation. The rotation feature uses a double locking system and can be locked in any position. Since the AirFlex uses air-powered flexion, adding up to 4 air-powered drops is an option, all controlled by the foot pedal or foot strips. The cervical air drop contains 2 drops in one headpiece. The first is a forward motion drop. Pull and rotate the black pin just below the cushion to convert the forward motion drop to a straight down motion drop. Adjust the tension knob to control the amount of force required to use the drop. The second air drop available is the thoracic drop. Again, use the tension knob to adjust the level of firmness. The third available air drop is the lumbar drop. The fourth air drop option is the pelvic drop. With the air drop system, you have the ability to use multiple drops simultaneously. Simply select the drops you want and tap on the foot pedal or optional foot strips to activate them. The headpiece options include a raised headpiece assisted with a gas-powered cylinder. It can rise and lock anywhere up to 5 inches. Manual cervical flexion is also available on the AirFlex. To use cervical flexion, secure the straps around the occipital region of your patient and disengage the tilting lock. Only a small amount of flexion is needed to produce successful results. Disengaging the rotation lock will allow for gentle circumduction and flexion. The thoracic section options include an air-powered thoracic spring breakaway. Before unlocking, preload the air cylinder to counterbalance the patient. This feature maximizes patient comfort while adjusting or while performing soft tissue massage. The AirFlex has the ability to perform manual flexion and also the option of automatic lumbar flexion. To use automatic flexion, set up the patient on the table the same way you would for manual flexion. Make sure the patient is perfectly counterbalanced and in a slightly flexed position. Press the start button on the automatic flexion control box and turn the flexion handle to the 1 o'clock position. Adjust the depth of the stroke using the up and down arrows. You may also control the speed and the amount of cycles from 1 to 100. Your patient will now receive a smooth and repetitive motion. With automatic flexion, performing circumduction is practically effortless. Adding the option of auto distraction turns your AirFlex into an effective traction table. The 6-inch touchscreen panel offers digital accuracy for controlled, fully repeatable treatments. The touchscreen is easy to use. Touch the rest setting to customize the number of seconds that the patient will be in a rest cycle. Touch the pull setting to customize the seconds that the patient will be in the pull cycle. Touch the rest percentage setting to customize the force during the rest cycle. This setting is limited to 50% or 25%. For example, with a force setting of 40 pounds during the pull cycle, setting the rest percentage to 25% will administer 10 pounds of force, 50%, 20 pounds of force during the rest cycle. Touch the time setting to customize the total amount of time for the treatment from beginning to end. Tap the manual button to switch to automatic mode and set the force setting. The treatment force is measured in pounds. It is programmable from 5 pounds to 100 pounds for a lumbar treatment and 5 pounds to 50 pounds for a cervical treatment. When all desired settings are entered, touch the green Run button to start the treatment. Your patient will now experience traction that is smooth and consistent. During a treatment, all of the settings on the touch screen will display actual values in real time, so you can monitor what is happening when it is happening. For first-time patients, it is suggested to use manual mode to distract and palpate your patients to determine the right amount of force needed. Pressing the Run button from there will use the desired amount of force as the maximum setting. During auto distraction, you may lock the patient in any flex position. Lateral positioning may also be used safely during automatic distraction. You can isolate one leg when treating sciatica by simply unstrapping one of your patient's ankles. To use automatic cervical distraction, Gently position the patient's occipital region into the upper inside ridge of the cradle support with the insert pad facing the ceiling. Tighten the tension knob until the patient feels a slight inward pressure. Secure the forehead straps and tilt the headpiece about 5 to 10 degrees. Pull and rotate the red pin located underneath the headpiece cushion. This will unlock the headpiece so that automatic distraction is possible. If the patient experiences discomfort, they can use the emergency cutoff switch. The table will then stop the treatment and return to a full resting position. To program a cervical treatment, touch the lumbar button to switch to cervical. Set